Knowledge about hypertension, diabetes. Find out in Sugar Beat, the Gets Pharma Philippines cardiometabolic social media platform. Knowledge about hypertension, diabetes. Find out in Sugar Beat, the Gets Pharma Philippines cardiometabolic social media platform.
Hello and good afternoon, ladies and gentlemen. Welcome to Sugar Beat. Sugar Beat is the official social media platform of Gets Pharma Philippines Cardio Metabolic Line. Sugar Beat aims to provide relevant and timely information on the prevention and management of diabetes and high blood pressure. All page contents are designed for every Filipino to embrace the value of wellness and self-care.
Previously on Sugar Beat, last Friday, Dr. Janica Dela Peña have shared with us the vital knowledge we need to know about hypertension among the elderly. This enlightens us especially on how we can take care of our older loved ones. To watch the replay, you may visit the Sugar Beat PH social media platforms. You can find us on Facebook, Instagram, and YouTube. What you eat is important to the health of your heart. Heart-healthy eating can help you prevent and manage high blood pressure, high cholesterol, or heart failure. In today's Feature Friday, we are so privileged to have a doctor who specialized in culinary medicine. To begin, let us meet our speaker. She finished her Doctor of Medicine at Iloilo Doctors College of Medicine. Finished her Master of Management in Health Administration at the Philippine Christian University. Finishing her Doctor of Public Health major in Preventive Healthcare at the Adventist University of the Philippines. A Fellow of the American College of Lifestyle Medicine and Philippine College of Lifestyle Medicine. The President of the Philippine College of Lifestyle Medicine. Finished her Culinary Medicine at Goldring Center of Culinary Medicine, New Orleans, USA, and at Lifestyle Medicine Institute, Boston, USA. She is the founder of Culinary Medicine Asia. Sugar Beaters, please welcome Dr. Michelle Palma.
Magandang araw po sa inyong lahat. Good evening, good morning, no, sa mga nakikinig sa atin, sa mga sumusubaybay sa ating Facebook page. Actually, I'm not sure kung sino yung nakikinig sa atin ngayon or nanonood. It could be coming from other country or it could be coming from the Philippines. But regardless kung saan po kayo ngayon, I'm so glad to be with you tonight and to talk about a healthy diet for a healthy heart. I'd like to thank Sugar Beat for inviting me to be with you. And this topic is actually very, very close to my heart because my family is really at risk of heart disease. So just recently, a family member died of heart attack. Just recently, my mom had heart attack as well. She's still actually recovering in the hospital. So very, very timely hinihingi nilang topic sa atin. Now, I'd like to spend the next 20 to 30 minutes with you as you watch this video na sana may makukuha tayong learnings kung paano natin ma-improve yung ating lifestyle. Not only on the diet, of course, we know that diet plays over 60% of its role in the development of lifestyle diseases, but there are other factors as well. Our goal for this evening is for you to learn something that you can translate at your home, sa mga bahay natin. Okay? Not all theories. Ang kagandahan dito, kung ano yung pwede nating magawa at ma-apply sa kanya-kanya nating pamumuhay. So I only have 3 objectives for this lecture. First, let's review the standard lifestyle intervention guidelines for the prevention of atherosclerotic cardiovascular disease. And then second, let's review evidences on lifestyle prescription for a healthy heart. And then lastly, I just want to introduce very quickly the practice of lifestyle medicine, okay? Because you'll be hearing a lot of this as we go along. So let's jump on to the first objective, and that is to introduce to you the guideline on how do you prevent heart disease, kasi yun yung ating target for this lecture. So here, before I go through the heart disease, let me introduce to you the important risk factors for heart failure. Bakit ba nagkakaroon ng heart disease or heart failure ang isang tao? Basically, it's not only the heart na nasisira kaagad. Unless you're born with a defective heart, then that's it. But otherwise, if you are a healthy person and then you develop these risk factors, then eventually you will develop heart failure. And one of those is hypertension. Eto nating alta presyon, diabetes, metabolic syndrome, and atherosclerotic disease. Okay, so please take note of those diseases kasi yun yung magiging focus natin. Now, this is the World Health Organization telling us na ito pa lang mga sakit na ito ay may tinatawag na modifiable risk factors. And I always say that this is a very, very good news. Not only for you na nakikinig sa atin, but for physicians and healthcare providers as a whole. You see, because behavioral risk factors can be reduced, it can be controlled by intervention. That's why we can reduce the probability of disease. So ano yung magiging focus natin? Mostly on physical activity, tobacco use, alcohol use. Pero ang focus natin for this lecture is unhealthy diet. Okay? Now here, for the first algorithm, sorry, you don't have to understand everything here, but I just want to focus one thing. Ito kasi ginagamit ng mga doktor na guideline. Halimbawa, we have to manage a patient with heart disease. So, anong gagawin namin para ma-prevent namin yung further progression ng heart disease? Ito yung ginagamit namin. So, ano yung nakalagay dyan? Top of the line sa guideline. Nababasa niyo naman siguro. Emphasize adherence to healthy lifestyle. So, dyan tayo magpo-focus. Okay? So, kahit pa we eventually end up providing medication sa aming pasyente, our first line of treatment, management, intervention, and prevention is really a healthy lifestyle. Now, even according to the American College of Cardiology, etong gustong-gusto ko tong bill na to because this is how we manage actually heart disease, no? So, we have the A, B, C, D, and E. So, but I will focus here on the diet, diba? But here, you can see for you to prevent heart failure, you have to take note of blood pressure, cholesterol, cigarette smoking, your diabetes, your physical inactivity, and of course, the medications, diba? Alright, so like I said, we'll be focusing on the diet dun sa mga pagkain na nilalagay natin in the mouth that actually ends up to our blood vessel that will determine whether yung ating ugat ba, liliit yung diameter niya or magiging normal siya. Okay? Now, basing on the guidelines, like I said, kasi dapat evidence-based tayo. So, ito yung kagandahan. Kapag evidence-based yung practice, hindi siya nanggagaling sa blog, hindi siya nanggagaling sa opinion lang ng kung sino man. So, pag sinabi nating COR, that means ito yung recommendation na binibigay sa atin on the guidelines. So here, what we have is 1. Yung recommendation 1, ibig sabihin yan, class 1 recommendation means it is a procedure or treatment that should be performed or administered. No? So lahat kami mga doktor, alam namin na pag class 1 ang recommendation, sa aming guideline, ibig sabihin dapat binibigay namin yan sa pasyente. Dapat nire-reseta namin yan sa pasyente. At dapat translated itong mga reseta na to sa knowledge at application ng pasyente sa kanilang mga pamamahay para epektibo siya. So ano yung nakalagay dyan? So we have diet emphasizing intake of vegetables, Fruits, legumes, nuts, whole grains, and fish may be recommended. So I'd like you to take note of these kinds of items dahil yan at yan ang ulit-ulitin natin for this lecture. Alright? So here, going to those risk factors, unahin natin yung hypertension. Kasi hypertension actually is one of the #1 killer in the Philippines kung malalaman natin. So basing on the guidelines, again, hayaan mo na yung iba dyan. I'd like you to focus on the red arrow. So once we establish diagnosis of hypertension, kapag ikaw na-diagnose ng doktor mo na may hypertension ka, ang first na binibigay nating treatment is lifestyle advice. Okay? Clear yan. So, klaro ito sa mga pasyente natin at klaro dito sa ating mga doktor at healthcare provider. Hindi po tayo nagbibigay agad ng gamot kasi we wanted to give chance for our patient to understand their situation so that they can take charge of their health. Hindi yung talagang sa gamot lang sila nagre-rely, kakain ng kung ano yung gusto nila, and then they will just rely on the medication. That's not the point. Okay? So, the moment a patient is diagnosed with even grade 1 hypertension, we start with lifestyle intervention. Kapag ito ay grade 2 hypertension, we give the drug, but we still start with lifestyle intervention. Ano yung mga lifestyle intervention na yan? That includes, again, yung sinabi natin kanina, A, B, C, D, D, E, no? Kasama din dito, smoking, regular exercise, but our focus here is healthy diet. Okay, so now here's another guideline for diabetes. So this is actually one of my favorites. No, bago ito eh. So this is very comprehensive because the American Association of Clinical Endocrinologists wanted to treat their patient as a whole. Hindi yung diabetes lang ang tinitreat nila kasi marami din risk factors for a patient to develop diabetes. So say for example, ngayon may tinatawag na tayong pre-diabetes at hindi lahat ng Pilipino aware na may pre-diabetes pala. Ang akala lang natin diabetes. But we have pre-diabetes. Now, what is the initial treatment here? Initial management is lifestyle therapy, okay? So that includes weight loss, etc. So even if we end up providing medication again to the patient, nandoon yung lifestyle therapy along the spectrum of the treatment. Same thing with glycemic control. Pag may diabetes na talaga yung pasyente, along the spectrum of the treatment, mag-umpisa man tayo sa monotherapy, and I'm sure you can relate with what I'm gonna tell you, di ba? The moment you go to your doctor's first visit, isang gamot lang muna ibibigay. Unfortunately, it's not working. Pangalawang visit mo or several visits after, hindi nag-i-improve yung condition mo, dual therapy na tayo, dalawang gamot na yung binibigay. Pag hindi pa rin talaga nag-improve, we end up with triple therapy or sometimes we end up with insulin. But regardless, of the spectrum of the treatment, nandiyan dyan yung lifestyle therapy. Okay? So, ano ba yung lifestyle therapy na sinasabi? Is for us to understand, that includes, again, nutrition, physical activity, sleep, behavioral support, nandoon lagi yung smoke cessation. So, but again, my focus for this lecture is nutrition, which is, look at the red arrow again and focus your attention there. It says, plant-based diet because you will be able to maintain optimal weight if you are onto plant-based diet. High polyunsaturated and monounsaturated fats. Avoiding trans fats. Limiting saturated fat. And kailangan natin ng structured counseling because this is a behavior change. Now, going to metabolic syndrome. Pinag-usapan natin kanina yung hypertension. We talk about diabetes. What about metabolic syndrome? Because it's another risk factor of developing heart problem. So, when you say metabolic syndrome, we again are focusing on to the atherogenic diet. So, nanonotice niyo po ba doon sa mga nanonood sa atin, halos diet ang pinag-uusapan. Kaya like I said earlier, with lifestyle therapy, parang over 60% of our intervention is literally focusing on the food intake of our patient. Okay, so now let's focus on the red arrow again kasi ang daming nakasulat. Very busy slide. Dun lang tayo sa red arrow. So what you can see here is an atherogenic diet. Anong ibig sabihin nun? This kind of diet will cause atherogenesis of hardening of your arteries. Okay? So ano itong mga diet na to? That means mataas yung saturated fat na kinakain mo at mataas yung cholesterol. Paano mo ibababa yung cholesterol? Let's go to this slide again. Now, focus on the red arrow here. Ibig sabihin, even if the patient is considered high-risk patient, moderately high-risk patient, or moderately high risk or moderate risk or even low risk patients with targeting doon sa kanilang cholesterol. Doon sa mga nanonood sa atin na nagpapalaboratory, I would really say na dapat alam niyo kung paano mag-interpret man lang ng mga laboratories natin at pwede tayong magtanong sa mga doktor natin, Doktor, ano po ba talaga yung target ko para at least alam mo kung ano yung magiging part mo. It's not only the medicine that we provide you, but on your own part kasi most of the time you're on your own autopilot. Okay? Ikaw yung kumakain. Ikaw yung gumagalaw every single day and that determines the control of your cholesterol, your blood sugar, and your hypertension. Diba? So now, going back there, what you can see in all these arrows are lifestyle therapies. Di po ba? Now, let me tell you that atherosclerosis or hardening of the arteries actually begins in childhood. Very, very amazing. Okay? Actually, matagal ng evidence ito eh. And in this research, they found out that almost all person aging 10 years old are actually beginning to have the fatty streaks. Fatty streaks is the initial formation of the atherosclerosis in the vessels of the heart. And according to the street study, kung titignan mo, exposure to high cholesterol concentrations sa mga bata may accelerate the development of atherosclerosis. Kaya ito yung lagi kong sinasabi. Especially the youth right now, they really think they are immortal. No? Kahit ano pwede nilang kainin kasi they don't feel anything. But you see, the development of atherosclerosis will never give you symptom at all. Sometimes, over 60% occluded na yung ugat sa puso mo, you're not even symptomatic yet. Diba? So, here on this research, they said that the prevention, the long-term prevention for atherosclerosis should start at the onset of infancy. What a great preventive advice, right? So again, atherosclerosis was found out to begin in childhood and they progress during adolescence and childhood. Yung bang hindi na nakokontrol ko ano yung kinakain mo, yung nakakabili ka na kasi may nakaka-afford ka na, and then by the time you indulge with a diet that you really like, doon nag-uumpisa po yung formation. So what's happening is, well, from 10 years old, the fatty streaks are developing. When we turn 20 or 30s, the fibrous plaques established na kaagad nandun na siya. And by 40s, there might be some calcification already that may cause hemorrhage, ulceration, or thrombosis. So if you notice, if it affects the heart, ang tawag po natin myocardial infarction. If it affects the brain, that's stroke. If it affects your lower extremity, the blood vessel right there, it's gangrene or aneurysm kung sa malalaking blood vessel natin. But there's good news. Bibigyan ko na kayo ng heads up because there are evidences showing us that you can reverse coronary artery disease with the help of lifestyle intervention, primarily diet. Now that brings us to the next objective, which is to review the evidences on lifestyle prescription for healthy heart. So here you can see that we have systematic review. Ito evidences lahat na sinasabi that educational nutrition intervention is really needed. And this is the perfect recipe for cardiovascular health, diba? And this is one thing I like, the recently published original research at the American Heart Association. They said that diets higher in plant foods and lower in animal foods were associated with lower risk for cardiovascular mortality and morbidity for the entire population. So very simple. Kumain ng mas maraming plant-based, less ang animal-based so that you will decrease the risk for cardiovascular morbidity and mortality. In fact, in these evidences, I will show you here very quickly. You see, there are areas in the world na yung heart disease is not even present. Ano yung kinakain nila doon? They are settled for whole plant-based food. Now, take note, this is Dr. Caldwell Esselstyn, one of the pillars in lifestyle medicine. That's me standing there with him. So I was actually in awe, in that stage because of this person. He has a lot of contribution in terms of reversing heart disease through diet. So he actually conducted a research, ang tawag nila sa mga pasyente niya, the walking dead, because they're not good candidate for bypass operation. So, there are many researches that are telling us that you will be protected with heart disease if you are on the plant-based diet. And that's what he did. So, ang ginawa niya, in some patients, he would give statins kasi he cannot control the cholesterol for some reason. There might be some familial predisposition or genetic factors at the same time. And so he would use drugs. But to other patients, he would use purely diet. So as you can see here, what happened in the research, he actually provided whole food plant-based diet dun sa kanyang intervention. You see a clear narrowing of the blood vessel right here prior to the intervention. After 1 year, you can see a clear 30% regression based on the angiogram. Ang galing, ang gandang good news, right? Ito pa, another patient, very clear. Diba? You can see here a narrowing of the artery in the heart yan, nasa puso. After 30 months in the therapy, in the treatment, this is nutritional therapy or lifestyle intervention, you will see a clear regression or reopening of the blood vessel. That is actually an amazing good news. Another remarkable person is Dr. Dean Ornish, and I'd like you to take note of these two persons. You can follow their Instagram, their Facebook, so you can learn more, about how do you take care of your heart. So Dr. Dean Ornish actually wrote this famous lifestyle heart trial. So this is a randomized what we call this study, na ngayon ang ginawa nila, yung mga nasa lifestyle group, you can see yung cholesterol nila sobrang baba, and the disease regression, yung kanilang heart disease actually, nag-regress ng 82% compared doon sa mga control group. Okay, so what they did, they actually provided whole food, plant-based diet. There is 90% reduction ng kanilang chest pain, and the result was sustained for 5 years. And the same study was replicated sa mas maraming pasyente, and they have the same result. So right now in the United States, we have this what we call Ornish lifestyle medicine, which is actually subsidized by the Medicare already. Now, konting review dun sa ating mga nanonood ngayon, just check yourself because these are the risk factor in developing heart disease. The more risk factor you have, the higher chances of developing heart disease in the next 5 years. So I'd like to take note sa pinakataas ang nakikita niyo is cholesterol, bad cholesterol, because that is one of the culprit. Now remember that cholesterol comes from the food that we eat every single day, and the cholesterol that's being produced by our body. The daily value for cholesterol is 300, but remember, if you have heart disease, if you have hypertension, at kung ikaw ay may diabetes na, dapat below 200 milligrams ang kinakain mo a day. Doktora, gaano po ba karami yung 300 or 200? So basically, I wanted to give you an idea on how much you are taking every single day, because like I said, everything you put inside your mouth will eventually end up to your blood vessels. So anong nasa ugat mo ngayon? So like I said, diba, sabi ng World Health Organization, unhealthy diet is a modifiable risk factor, not only for heart disease, but for the rest of non-communicable disease. Definitely, this is a good news kasi may pwede tayong gawin. We can control. Now, how much of a cholesterol you are taking every single day? Check this slide. So, gaano karami yung cholesterol? I cannot discuss this further with you, but you can check this. Maybe take a screenshot and review every time nakakain tayo, diba? So, like for example, if you're eating 1 egg yolk, that means that will provide you 184 milligrams of cholesterol. So, that's enough for you for the day. So, what about yung lunch? What about the dinner, which is the largest meal of all? So, that means we are eating 3 folds, 5 folds, 6 folds, sometimes 10 folds of the cholesterol na kailangan natin lang every single day. In this research, very, very quickly, this is the Adventist Health study showing that depending on the diet of the person, depende dun sa diet ng person, actually that determines a risk for developing chronic conditions. So remember, so question ulit, nasaan po kayo dito ngayon dun sa mga nanonood, nagmo-monitor sa atin? So are you at the 48% who are non-vegetarian? So that means you eat anything, exactly. Or those who are semi-vegetarian, your preference is still vegetables, but sometimes you can eat meat, sometimes you can eat chicken or fish or poultry. Or are you pesco-vegetarian? Kasama yung fish, but walang meat and poultry. Or 20, dun tayo sa lacto-ovo-vegetarian, you include dairy and egg, or dun tayo sa total vegetarian. Now, please also remember that not all total vegetarians or plant-based are healthy kasi there can be junk vegans. Diba? Like I always mention, French fries and then potato chips, they are junk plant-based food, diba? So that's why we always emphasize on whole food. Now, in this study, they were able to find out that those who are eating more plant-based diet are lighter compared to those who are non-vegetarian for both female and male. And we do not want adiposity or overweight because it promotes chronic low-grade inflammation, which can eventually end up to developing insulin resistance, type 2 diabetes, hypertension, and cancer. So as much as possible, we need to get rid of those fats that we keep wearing every single day. So again, the same study actually tells us that there is really a dose-response relationship. Kung ikaw ay more on plant-based diet, if you can see, you have the lowest risk na magkaroon ng high cholesterol. Same thing with diabetes type 2. Lowest risk if you are more on plant-based diet, and highest if you are more on animal-based diet. Same is true with hypertension and of course with heart disease. If you eat more on the plant-based, you get lesser and lesser chances or risk for heart disease. Why are we always talking about whole food plant-based diet? Because they are directly linked to longer lifespan, consistent extra weight loss. You are eating more, but you are shedding off those excess weight, lowering of cholesterol, prevention and reversal of heart disease, of high blood pressure, of type 2 diabetes, even the treatment of acid reflux, which is a dilemma of many physicians. Ang dami-daming Pilipino ang laging may acid na hindi natitreat, basically because of so much greasy food that we are eating, so much and other substances that we keep eating. I hope we can talk more about that, but that's not the topic, no? Kasi acid reflux, another new thing. And of course, helping patients with constipation, hemorrhoids, and diverticulosis, helping patients to lessen asthma attack, and of course, more importantly, patients with kidney or chronic kidney disease. If you take note, with the report that we are seeing this time of pandemic, you will see the same non-communicable diseases that are actually increasing the risk or dictating the fate kung anong mangyayari doon sa mga pasyenteng infected by COVID-19. Itong evidence na to is telling you that if you have heart disease, you have higher risk of dying because of COVID-19. Same is true with diabetes, chronic respiratory disease, high blood pressure, and cancer. And nakita nyo to doon sa na-discuss natin kanina. So just a very quick comparison of the diet that people are taking in the modern times compared to the optimal, kung ano talaga yung kailangan natin. People right now are eating too much of fat, too much of oils, too much of sugar, so many cholesterol, so many sodium, and less of the fiber, and less of the water. And I know that you will agree with me. So my question here is, what is occupying the center of your plate? So is it this kind of plate, or is it this kind of plate? So I know that this is what the Americans are eating, but as long as the countries westernized, we adopt them. So our goal this time is, hopefully, while watching, this series that we have, or this topic that we have, hopefully you will have this second thought to somehow transition from this kind of plate, na sana somehow ma-reach natin itong plate na to. Kahit not perfect, no, na everyday ganyan, na every meal ganyan, basta kailangan within the day may green corner tayo. And then kahit pa sa ibang araw hindi pa natin kayang i-let go yung red corner, hopefully may mai-add man lang tayo on the green corner, because we know that that will decrease the risk for obesity, type 2 diabetes, heart disease, and some cancer. And we are down to the last objective, which is introducing the practice of lifestyle medicine. Kasi I've been talking about lifestyle intervention. Ano ba talaga si lifestyle medicine? In fact, in 2010, it was published in the Journal of American Medical Association, the physician's competency for prescribing lifestyle medicine. So we have 6 pillars of lifestyle medicine that includes healthy eating of plant-based food. Kaya yun yung pinag-uusapan natin ngayon. I'd like to quote here what Dr. Neil Barnard said. He's the founding president of Physicians Committee for Responsible Medicine. He said, ignorance of nutrition is no longer defensible. Dahil alam na natin, evidences are telling us na ang pagkain has something to do with our risk to developing chronic conditions. So that sinasabi na nga natin ngayon na dying from chronic diseases seem to be a choice this time. Choice mo na talaga yun kasi evidences are clear already. So, our goal here is to motivate our patients and motivate ourselves too kasi hindi lang naman pasyente apektado. We, healthcare providers, are affected as well. In fact, in the United States, the American Medical Association, they already supported the integration of lifestyle medicine competency sa pag-aaral ng medisina. So in the US now, as you can see here, lifestyle medicine is already implemented in the education system, including internal medicine, family medicine, preventive medicine, so on and so forth. Sa Pilipinas po, good news because meron na pong medical school na nag-uumpisang i-integrate yung lifestyle medicine, which is the Adventist University of the Philippines and the Public Health, the College of Public Health of AUP. And we also provide this as a continuing medical education. So far right now, there are 89 physicians who are certified lifestyle medicine practitioners. So ito yung mga doktor kung saan nire-refer sa amin ng mga cardiologists, internists, pediatricians, OBGYNs, etc. yung mga pasyente nila na kailangan ng lifestyle intervention, lifestyle program, and lifestyle counseling. So like I said earlier, one of the largest intervention or the in lifestyle medicine is nutrition, and that includes culinary medicine, which is a new evidence-based field of practice in medicine that blends the art of food preparation and the science of medicine. Ang goal dito is for us to improve the overall health impact of the patient para kailangan naming mapaintindi sa pasyente na yung kinakain nila has something to do with their condition and for them to enjoy healthy eating. Now here we talk about nutrition education, yung cooking skill, paano magluluto, how do you prepare, how do you flip the plate from having animal-centric to plant-based centric, paano mo ba uumpisahan yun, di ba? And of course, we talk about healthy behavior. You see, after our talk in this lecture, the world is not changing. Pareho pa rin yung paligid mo, pareho pa rin yung lifestyle around you. So here, we need to have a good mindset, and we need to have a behavior change because behavior never change overnight. So it's a long process. So that's why we need motivation and we need support. And that's what we provide in lifestyle medicine. Definitely because the physician's knowledge, attitude will determine our practice. Simple lang yan. If the physicians are not practicing the healthy lifestyle, it will be so hard for us to counsel our patients the same. Mahirap sabihin sa pasyente, mag-ehersisyo ka, kumain ka ng gulay, kung kami hindi namin ginagawa yun. If we do not personally pursue the lifestyle, it will be hard. Kaya hindi po lahat ng pasyente nabibigyan ng lifestyle counseling. So before I end, I want to show you this very short video. And I really hope that you can have a glimpse, and understanding on this 1-minute video.
All right, what do we got?
Just came in, heart attack. 5'9", 300 pounds, 32 years old.
How the hell does that happen?
Can I get a, Could be developing diabetes. Let's make a change. Oh, yeah.
You're graduating! Watch TV. You won't even have to leave.
You can't do this.
Yes, can I get a...
Yeah, no, deep push.
You have to make a change. Good job, Jim. You got an A+. Here are your fries, sweetie. still can't believe you give this child French fries.
I know. It's the only thing that'll make him stop.
All right. So I hope you learned something from that very, very short video. Like I said, heart disease begins in childhood. Parents, especially mga nanay, you have a huge role and contribution to the future disease of your children. Your familial behaviors will be passed from one generation to the next. So remember, in summary, we discussed about the simple, heart-healthy lifestyle, focusing on controlling the blood sugar, healthy weight, cholesterol, blood pressure, smoking, physical activity, and of course, the heart healthy diet. Transitioning from this kind of plate to this kind of plate, more on the green corner, more on plant-based centric than animal-based centric plate. Now, the take-home message here, like I want to quote from the American College of Cardiology, a healthy lifestyle should be promoted throughout life, regardless of the age. Regardless of the age, all ages. And please remember, and also as doctors, no, kung may mga doktor na nakikinig sa atin ngayon, and then sa mga nanonood din sa atin ngayon ng mga pasyente, you can ask your doctor for counseling, okay? So hopefully they will have time for that. Or maybe you can ask for referral for dietary programs, for example, because oftentimes here in lifestyle medicine, even if we provide patient with prescription, like we provide patient with a drug, for example, for heart failure, we also provide a recipe, for example, or we provide a plant-based prescription like legumes, 1 to 2 servings in each meal, literally. So actually, yours truly provided this handbook in culinary medicine that has came out, and then coming out is also lifestyle medicine manual. And sometimes, like I always say, sometimes gusto ko na naka-white coat ako na doktor ako, but oftentimes I enjoy wearing the chef coat kasi mas natutulungan ko yung pasyente. I can engage better with them, talking about the diet and feeding them healthier choices, and opening up their mind and setting up a new mindset for them to develop a healthy behavior. Now, if you are willing to receive a food as medicine jumpstart, we have this link, that we can provide you. You can always message us, or you can always send message to the Facebook page of Sugar Beet so that they can also provide you the link, because this is a good material, free material coming from the American College of Cardiology and the Philippine College of Lifestyle Medicine and the Culinary MD Asia that can help you jumpstart to use food as your medicine to have a healthy heart. So again, these are free resources that you can get. So please take note that heart disease starts and begins in childhood. Prevention should start in infancy. So it's not too late. It's never too late to change. Now, lastly, para sa mga nakikinig sa atin ngayon and nagmo-monitor sa atin, para sa kaalaman tungkol sa diabetes at hypertension, you have to subscribe dito sa Sugar Beet, and this is powered by Gets Pharma Philippines. Maraming salamat.
Thank you to our guest speaker for providing with us another informative virtual session here in Sugar Beet. For more informations like this, please like and subscribe to Sugar Beet social media platforms. You can find us on Facebook, Instagram, and YouTube. Next on Sugar Beet, please tune in and visit our page to watch another exciting webinar topics that will leverage your knowledge about diabetes and hypertension. Do you have a question about diabetes and hypertension? Our chatbot is ready at your service. Please send us a message on our Facebook page Messenger and we'll try our best to give you the answers. Consult your doctor while you're at home with Dokuto Telemedicine application. You can now download this to Apple Store and Google Play Store. Once again, thank you for joining and see you again on our next program.